Hello, I'm glad to have you here. You're welcome. So today we are going to talk about NMC OSCE assessment tools and specific nursing problems. So in OSCE APIA section, um, an assessment part, we might be given something like Mr. X was brought to the emergency unit due to fever and cough. A diagnosis of coronavirus was made, and Mr. X was stabilized and later taken to the ward and complete an assessment using this tool, and they're focusing on this or that. So we are going to talk about the tools today, and then I'll mention some specific nursing problem pertaining or related to that particular assessment tool. So these are the assessment tools. We have News2, GCS, PHQ9, Malnutrition Universal Screening Tool, and observation charts. So in a scenario, you are going to get at least one of these for your assessment. So today, let's look at News2. News2, you can be given News2 for your assessment if you have a scenario on asthma, CHF, COPD, or pneumonia. So these are some points for you to carry out your assessment successfully. You need to remember this. The first point is either mark or use a number. So you can use a mark or like an X and then add those specific number you got by the side, or you can just mark an X. So, but if you use a number, it helps you to remember the accurate value. Like if you are planning on breathlessness, so your evidence by respiratory rate of, then you can add it. Then the next point, remember to total accurately and sign. Even if you got you did everything right, but you didn't get the total right, or you forgot to sign, will lead to failure. Then the next is accurate identification of clinical response. So on the News2, they will ask you whether you escalate. You answer yes or no, and afterwards you tell the patient your clinical response or what you're going to do for him or her. So example, you go back and say, okay, I'm done with your observation. So the total is 4, because you have your respiration was this or that. So the total is 4, and so I'll be monitoring you. Yes, so hours. You need to identify. You need to identify your clinical response, and you need to get the accurate monitoring frequency. They will give you another a paper for that, where you will see your monitoring frequency and your clinical response. So this is an example we are going to use to fill out this News2 form. Temperature is 38.2 degrees centigrade. The pulse 70, respiration 24. BP is 120/60 millimeter mercury. SpO2 is 95%. So this is News2, half of it though. Full name of the patient, date of birth of the patient, and date of admission. This could be pre-filled or not. You are using just one line, date of your exam and the time. You can confirm time from your assessor. Now, so using this, so expression is 24. There is something you should note. Going up, there is no one. But going down, there is one here. So remember, if it's not white, it's either 2 or 3 going up. So the next one is SPO2. You are using the first scale, not the second. And our SPO2 is 95%. 95 is here. It's supposed to be an X. So I said either mark or use a number. You can write the value anywhere here. So the next one is air or oxygen. Is the patient on oxygen or not? So our patient is not on oxygen. Is air. So if the patient is on oxygen, you write the liter per minute here and the device the patient is using here. And then the value will be 2. No 1, no 3. The BP is 120/60. 120 is here. 60 is here. You join. Good. So because I may not be able to come back to this, I'm going to get the values. We have 2 here, 1, already 3. Then this is 0. You are using only the upper one, so it's 0. So already we have 2 and 1, which is 3. Pause. So our pulse is 70 here. Our temperature is 38.2, which is here. And consciousness, persons be responding to you a lot. If not, you mark where, but my patient's been responsive. Now, the next is News2 total. We had 3 previously. Anyone, 0 here, 0 here, and 1. So now it's 4. Then a monitoring frequency, you are going to get something like this here. So 4 is where 1 to 4 is 4 to 6 early. So this is your response. Monitoring frequency is 4 to 6 hours. During your planning, you can monitor the patient every 4 hours. Tell your patient also you monitor him every 4 hours. Yes. Initials. They shouldn't pass the line. I'm struggling. So, like I said, you can write numbers to help you in planning. So long as it stays within the boxes. So that is it about News2 and charting it. Right, so these are some specific nursing diagnosis pertaining to News2. The first one is risks for deterioration, complication related to the disease you did assessment on. How we came about these risks for deterioration. News2 is used to assess patients at risk for deterioration. For the fact that you used News2, the patient is already at risk. How we came about this. Now, your evidence is your News2 score, whether it's greater or equal to 0. So any value you got is you insert here. Now, I think we got 4. Is this 3 or 4? So our News2 score will be inserted here. To make it risk for deterioration related to pneumonia, evidenced by News2 score of 4. Pertaining to the temperature, so if it's high, you can do something like fever, hypothermia, or increased body temperature. Related to the disease you did assessment on, which could be pneumonia, CHF, asthma, evidenced by the temperature value you got. Now ours was 38.2, so we'll put here. Now if you have something lower, have low body temperature or hypothermia related same to the disease condition and evidenced by the temperature value. Now the next one is respiration, and pertaining to that, if it's not within normal, so you can't have breathlessness, diagnosis like breathlessness, shortness of breath, difficulty breathing. Now it is related to the disease and evidenced by your respiration rate or respiratory rate of the patient. Ours was 24, so we have difficulty breathing related to pneumonia, evidenced by respiratory rate of 24 breaths per minute. The last is concerning the BP or oxygen saturation or pulse. If they are high or low, you can do something like this: poor or inadequate tissue perfusion related to chronic heart failure or whichever disease you did assessment on, and evidence by your BP value, oxygen saturation value, or your pulse. So this you could use this. I think I have a video where I did some interventions under each of them, and you can take a look. So, and another thing about this, if you're good with NANDA, it's better to stick with it and develop it. Don't try to unlearn and start learning a new one. So you can actually use NANDA, you can use the normal one, anyone you are comfortable with. I thank you for your time. Take a look at my other videos. See ya.